Hello everyone. The bones of the hind limb, including the pelvic girdle. We'll look at the pelvic girdle first, and then we'll look at the femur, the tibia, fibula, the set of the tarsal bones and metatarsal bones. As we mentioned earlier, the metatarsal bones are quite similar to the metacarpal bones. The proximal sesamoid bones, as well as your dorsal sesamoid bone, all these bones are going to be almost similar in the forelimb and hind limb. Okay, so let's look at the pelvic bone first. Now here we're looking at the pelvic bone of the dog. It is seen as if we are seeing the bone from the dorsal view as well as caudal view. So as if we are standing behind the animal and we're looking at the pelvic bone from there. So we have the pelvic bone on one side and the pelvic bone on the other side. So this is your right pelvic bone and that is your left pelvic bone. The lateral surface, the medial surface and the medial surface. But then as we know, the pelvic bone basically on each side is made up of three different bones: ilium, ischium and pubis from inside, and it is both of them, they are articulated with each other along this ventral midline that forms the pelvic symphysis. So right here, pelvic symphysis is seen from top, as well as when I turn it upside down, we can see the ventral view of the pelvic bone. We can see the pelvis and we can see the pelvic symphysis right here. Basically, pelvic symphysis is formed by ischium as it articulates on each side, from each side, as well as pubis as it articulates from both sides. So this part is called pubic symphysis and this is called ischial symphysis, and entirely it is called pelvic symphysis. Okay, now after this we are going to look at individual pelvic bone. When I say individual pelvic bone, we are still considering adult pelvic bone, which would be combination of the ilium, ischium and pubis. Let's turn it back again and let's look at different views of the pelvic bone. This is the caudo-dorsal view of the pelvic bone, as it is seen from the caudal as well as dorsal aspect. We turn it this way. This is the cranio-ventral view of the pelvic bone, and that is the ventral view of the pelvic bone as it is seen from the ventral side of the animal. Okay, let's put this one back and we get the pelvic bone from one side. Now this is the right pelvic bone as it is seen from the top, and this is now the lateral view of the pelvic bone. As we see, the lateral surface, the acetabular cavity, the ischiatic tuberosity. This is your ilium, this is ischium, and then as we go more from the ventral view, that part is the pubis. Let's look at the right side pelvic bone. We're looking at the lateral view of the pelvic bone with the cranial end and the caudal end. Here we see the ilium, the ischium, and from the ventral view we see the bone pubis. The ischium is further extended on the caudal aspect as well as on the medial side, while pubis looks almost entirely on the medial aspect of the pelvic bone. The acetabular cavity with acetabular fossa is also visible from the lateral view. As we look at the closer view of the bone ilium, this is the gluteal surface of the ilium, the tuber sacrale or sacral tuberosity, the crest of the ilium, the tuber coxae or coxal tuber. Those parts are seen clearly on the lateral aspect. As we go further on the dorsal border of the bone ilium, further continue backward, we see the greater ischiatic notch, which would be continued further the ischiatic spine. Now these are the parts of the bone ischium, so we'll look at them slightly later. Around, and we'll look at the medial view. The medial view, we again see shaft of the ilium, the wing of the ilium, the sacral tuberosity, the coxal tuberosity or tuber coxae, and we see here the sacropelvic surface of the wing of the ilium as well as along the shaft of the ilium. Here we can say ilium, or here we can see ilium is further fused with the bone ischium as well as pubis. Pubis being located more on the medial aspect, ischium located more on the caudal aspect of the ilium. At this point we see a very distinct articular area, that is articular area for the wing of the sacrum, where the sacroiliac joint is going to be formed. Along the cranial end of the bone, we see the crest, which is the iliac crest. So, same iliac crest can be seen from the lateral aspect as well. The iliac crest, the sacral tubercle or tuber sacrale, coxal tuber or tuber coxae, the greater ischiatic notch, the gluteal surface, wing of the ilium, shaft or body of the ilium. Medial view, shaft of the ilium, wing of the ilium, tuber sacrale, tuber coxae, crest of the ilium, articular surface for wing of the sacrum on the sacropelvic surface or medial surface of the of the ilium. Now let's move further backward. Let's go back to the lateral view again. In the lateral view, we see the bone ischium. The major structures associated with the ischium are the ischiatic spine, the lesser ischiatic notch, where we see the tendon of internal obturator is going to be running over the lesser ischiatic notch. More caudally, we have the ischiatic tuberosity. As we go further caudally, we can see part of the ischial arch on that particular side. Here we have the pelvic symphysis. On the caudal aspect, we see the part of the pelvic symphysis which is formed by two ischial bones, that is called ischial symphysis. Then we can look at the table surface of the bone ischium, and we can see the obturator foramen, which is formed majorly by means of pubis and the ischium. The ilium does play a little role in formation of this big foramen. Here is your obturator foramen. Now we'll look at the bone pubis, one of the bone which form the pelvis on each side. The pubic bone is seen clearly from the ventral view as well as from the dorsal view. As the bone is located more on the medial side, it can be seen clearly from the medial view as well. So we see the medial view here with the bone pubis located right here, the cranial ramus of the pubis and the caudal ramus of the pubis. From the ventral view, the same structures are seen, the cranial ramus of the pubis and the caudal ramus of the pubis. These two are important features. This tubercle here, which allows attachment of psoas minor muscle, that is your iliopubic eminence. As it is present at the junction between ilium and the pubic bone, it is called iliopubic eminence. The iliopubic eminence can be seen from the dorsal aspect as well. We see here is the iliopubic eminence. More medial to the iliopubic eminence, this structure or this area is called pecten of the pubis. Pecten of the pubis serves an important attachment area for the rectus abdominis muscle. The acetabular cavity, as we see the acetabular cavity here from the ventrolateral view, we see the area which has been highlighted in blue color is the acetabular cavity, which also includes a fossa which is located at the center of the acetabular cavity, which is called acetabular fossa. The incompleteness of the rim forms a notch on the medial as well as caudal part of the acetabular cavity. The notch is called acetabular notch. In the live animal, that notch or that gap would be filled up by a ligament which runs across the acetabular notch, which is called transverse acetabular ligament.